My name is Dr. Rebecca Cramp, and I am the Scientific and Reg Affairs Manager here at IPHA. I would ask you all to mute when you are on the line, and also wish to advise that this session is going to be recorded. Today, I'm going to take you through the increase in traffic to the site, some exciting new developments, and also relevance of the site during the pandemic. Firstly, the all-important traffic to our site. If we compare the statistics from September 2019 to those in September 2020, you can see that we have a 38% increase in search appearances, but also a 60% increase in search clicks, and that's year on year. If we look at visits, we've also got a 38% increase in visits, and that's looking at the period of from October 18th, year on year. So if we compare the years of October 2018 to October 19 and compare that to the statistics for October 19 going on to September 2020, so the annual comparisons, we see a 38% increase in the visits and a 77% increase in users over the same period. In terms of our interesting new developments, we'll be rolling out shortly what we're calling monthly analytic reports, in which member statistics will be broken down by page type. You'll be able to download the tracking of your documents, and it'll give you details of the top 10 most viewed SBCs, pills, and educational materials for your medicines. We already have the September data available, and that would be issued to you this week on the 22nd of October. And then following that first report, you will automatically receive regular reports starting on the 1st of November. They'll be emailed directly to you as level A users. So this is what the report will look like. You will see the total number of sessions, and it'll be broken down by SPC, educational materials, package leaflets, etc. You'll also get, as I mentioned, those top 10 interactions per item. So what are the top 10 in terms of SMPC views? You'll have it per actual document that was viewed. You'll also get medicine profile views, and that is individually for your company and for your medicines only. Further, you will get the educational material if you have educational material loaded. Obviously, not all of you do, but you'll get information on the educational material that is aimed at healthcare professionals and also that is aimed at patients. Finally, you'll get the document history, and of course, the terms will be explained within each document that you receive. Furthermore, we are bringing out a new help desk, which is a dedicated participant help desk. You'll have a searchable knowledge base where frequently asked questions will be contained. You can see all your company tickets that have been issued from the start of this new help desk. You'll have a ticket history and response times, and that goes live this Tuesday. So first thing tomorrow, this goes live, and you can see a picture of that new help desk there on the screen. We're also rolling out a new homepage. This will focus on the user experience. We'll have a more unified color palette. You'll have vital statistics here in the blue area down here. It'll give you, for example, the number of medicines that are there at the time, the number of SPCs, and all your critical key vital statistics. Below that, you'll see a company slider where your company logo will appear. It will move and change so that each time an individual clicks on the website, there'll be a different number of company logos displayed. We also have the latest updates, and this is due to be rolled out in January 2021 or before. Furthermore, another update will be the enabling of individuals to upload pack shots of their medicines. Now, they'll have to be obviously the regulatory approved pack shots, but you'll be able to load those up to the website beside your medicine. You can load up to 4 images on the profile page. There'll be one primary image, there'll be a thumbnail gallery, and it'll be easy for members to consume the content. And we roll that out in January 2021 or before. We imagine that most of the consumer healthcare companies will want to put images of their packs, and we also will encourage those who have prescription medicines to do the same. There will be specific criteria. I mentioned that there should be 4 images, but there'll also be a maximum image size. There'll be 2 file types accepted, and the image dimensions must be a square aspect ratio. If they're not, the image will simply be rejected, and you'll have your go back button available to enable you to load different pack shots. I would strongly suggest that you use the highest quality pack shots if you choose to use this feature. We are also integrating with what's called the IPU, which is the Irish Pharmacy Union, and they have what's called a product file. And that information is sent out to all pharmacies on a monthly basis. And that would be information on the price of medicines, the availability of medicines, etc. But all your data through us will also be sent to the pharmacies. So what they'll be seeing will be your educational material, your pack shots when you choose to put them up, your SPCs, etc. So the information that they'll be retrieving will be coming from Medicines.ie. So we'll have that direct link between Medicines.ie and the IPU product file. It's the beginning of the next phase for Medicines.ie, where we integrate with our key stakeholders, and that is due to be rolled out in January 2021 or before. And I'm going to take you through an interesting behavior and attitude survey that we conducted recently because it's directly relevant to Medicines.ie. So we know that it's 6 months since our lockdown. We've had a number of deaths and a high number of cases. But what this study was, it looked at self-care and well-being through the lens of COVID-19. The survey was an online survey of 1,000 adults in one of the weeks in September, and it's updating the measures from a similar study that was carried out 12 months ago. We know that the pandemic was probably the biggest system shock any of us will ever experience. Our economy is down between 13 to 15%, unemployment is at 17%, and we have another lockdown imminent by all accounts. So the pandemic saw 1 in 4 individuals visit the doctor less, with 1 in 5 too afraid to visit at all. It also saw massive growth in the numbers interacting with pharmacies since the onset of the pandemic. 3 out of 4 feel they have experienced negative health consequences, and 2 out of 3, which is mostly the younger population, have experienced a positive health dividend from COVID. The takeout, however, is that they are moving towards internet sites, they are moving towards pharmacies. We are integrating with the pharmacies and we are upgrading our website. So it's an important time for you to make sure that all your information is correct on Medicines.ie. So that was just a short introduction to some of the key aspects that we wanted to share with you, which is the increase in traffic, our exciting new developments, our ongoing innovation upgrade of the site, and how Medicines.ie is even more relevant now due to the pandemic. If you have any questions, feel free to ask. My colleague, Dr. Emer O'Leary, is here to also answer your questions with me. So what I'll do is I'll open the floor and await your questions. Feel free to type them in the text box, or you can unmute and say it. Probably easier if you type them. At the moment, we don't have any questions, but I think we might have one just popping in there. I thought I saw one. No, none yet. So I'm going to hand over.
Well, being very quiet.
Yes. Well, I'll ask you a question, Emer. Tell me about the cost of these new improved features.
Yes, well, I suppose we would like to let everybody know that there is no cost to any of these features. We've been working on this upgrade of the site since we launched it 2 years ago, and this is kind of features that we had always been hoping to develop. We're just happy to be able to bring them with us now. So there is no extra cost. Next year it'll be the same fees as this year, including all these new features. There's a question out popping in here. Are we able to share the slides? Somebody would like to share them with the team. I think, Rebecca, we've recorded this and we'll actually be able to send the recording around as well as the slides to members.
Correct.
Now, a couple of questions coming in here now. I had a question. Do you have any plans to include DHPC letters linked with the specific medicines on the site? And are there any plans to include other product information, stock availability, etc.?
So in terms of DHPCs, very much we would like to do so, and that is our intention as part of future developments. When one suggests other documents, it would depend on what documents. We will always be happy to examine adding regulatory authority approved documents for this site. So if that individual would like to email or suggest specific documents, we'd be happy to consider those. Anything that's promotional obviously won't be on the website.
And we won't have the ability to stock availability, she was asking in particular.
No, we won't.
No. Yeah. And another question here, are pack shots for POM medicines also?
Yes, they can be loaded. Once that facility is open, they can be loaded. We think it's important for the accurate use of medicines. Patients may have packs available, they may have thrown out the package leaflet, etc. And we think it would be very valuable for members of the public, particularly, to be able to look at their medicine pack that they're holding in their hand and compare that directly on the website. We think it's going to be a very valuable feature for both prescription medicines and non-prescription medicines. So we know from feedback from various users that they would like to have this facility. So we feel it's probably going to be very well used once it's up and available.
Perfect. Don't think there's any other questions coming in here. I have a question back for you actually, Rebecca, in terms of the pack shots. If for prescription medicines, can a photo of the actual tablet, the medicine itself, be uploaded also?
What we're permitting at the moment is just the pack shots. We will certainly look at adding the individual tablet, but that would be something for the future. We've looked at other websites throughout Europe, and one or two of them do have the individual medicines, but they're typically, interestingly, not used by patients or healthcare professionals. They would use by the narcotics units, typically, who find such medicines. So in many countries, they have it available, but members of the public don't tend to use it, and it can be a lot of difficulty for individual companies to find those exact pictures. Whereas for marketing purposes, one might already have pictures of the packs. It's less common to have good quality pictures of the individual tablets, capsules, etc. But of course, as I mentioned earlier, we'd be happy to consider it. If members come back to us and participants say it's something they want to have up on the website, we would certainly look at that as a future development. So it's not on our plan at the moment. DHPCs are as part of our rollout plan. So if members think they'd like to have the pictures of an individual tablet, capsule, etc., please do let us know.
Okay, I don't think there's any further questions coming in. So as we mentioned, we have another one. One of our promotional brochures has a pack shot with the glass ampules visible alongside. If we submitted this, would you review and allow, or would it be deleted?
It would not be permitted. It is the pack shot only, and that's from the regulatory authority directly. They say pack shot only. I'm sure you could crop that picture and add a cropped version, I would imagine.
Right.
Now, if the pack itself has a picture of a tablet on it, that would be okay, so long as it is an actual pack shot. That's the clear thing. It's not what's on the pack, It is that it is a regulatory authority approved pack shot.
Okay, because there is another question. Yes, we would like to have a picture of our inhalers and tablets as well as carton if possible.
Thank you for that. We'll look into the development of it, and that's a very positive thing. If any other companies are interested, do let us know.
Perfect. So again, we will be sharing the slides and this recording with all users of Medicines.ie shortly.
Do let us know if you'd like to have any other seminars or opportunities to ask questions. Well, you know where we are and you have the help desk, but do let us know if you'd like to have these on a regular basis every 6 months, etc., or simply when we're advising of an upgrade or we're rolling out new features. Do let us know.
Another question there actually, how many pictures of the carton can be uploaded?
4, a total of 4.
And yeah, just one money. Yeah, that's the same question.
So there'll be one which will be the primary image, and you can choose that. So the first one you load will be the primary image, but once you've loaded all 4, you can then move it around, and then the 3 will be as smaller thumbnails. But you can change that yourself. As with everything on Medicines.ie, the individual companies, you as individual companies, have absolute control. It looks like we don't have any more questions.
I think that's it. Oh, no one more. Thank you for the presentation. It was very useful. So good to know. Thank you.
Thank you, everybody.
Perfect.
Okay. I think we'll end the session there, and just to say thank you kindly so much for everyone who attended, and we hope you found this useful.